Hi guys, good evening all of you. Welcome to this INICET May 2025 recall for PSM. Me and Kashish sir both will take you through this journey. The questions in PSM were mild to moderate, and except for probably one, the rest were all questions which we expect AIMS will ask. Because it was the INICET exam, so it will be statistics or epidemiology heavy always as a routine. And it's good because they did not go with many outlier questions as such. Questions were from health programs, questions were from demography, from vaccines, from vectors. Yes, so we will have a good amount of discussion over here. Over to Kashish sir for his introductory remarks.
All right, so hi everyone, this is Dr. Kashish. So, as Sir has rightly said, this INICET was a mixture of epidemiology, some portions of biostatistics, and what Sir I felt is this: the questions in biostatistics, in demography, they were exactly modified NEET PG 24 pattern, which I observed. So, I would like to say that this INICET paper was a mixture of modified NEET PG 24 plus some of the outlier questions, as you said. If you see pair t-test, the sampling, and demography, these three were questions. These three questions were exactly there in NEET PG 24 as well. So, and these questions were there in FMG as well. FMG PSM, these were there as well. So, this makes these topics a very high yielding topic for the upcoming NEET as well. This is what I feel, sir.
Great. So guys, I would be taking the odd numbered question. Kashish sir will be taking the even number question. So we will be alternating so that we'll have a good amount of discussion. So let us start. Now first, if you look into the question distribution, statistics and health programs each were contributing 4 questions each, which shows that a balanced paper was made. There were overlap with other subjects, which is a routine, but we are not covering them. We are only sticking to core PSM, where we say that 14 to 15 questions were from PSM, which is again a norm in the INICET exam. Coming to the first question of statistics. As a PHC at a medical officer provides treatment and counseling to diabetic patients, their body weights and blood pressures were recorded before and after using the health register. Which of the following statistical tests is the most appropriate to analyze the change in weight in the group? Now, guys, this question is a standard question where you need to follow 4 steps. The first step is number of groups. So number of groups will be 2. It is a paired data. The output variable was quantity because you are talking about difference in weights or blood pressure levels. So the algorithm number 2 answer was paired t-test. Now, interestingly, there were some students who later messaged and saying that, sir, it was written there were 100 people. So it should be ANOVA. Now, guys, please try to understand. ANOVA will be done when there are more than 2 groups. N100 is sample size. It does not mean the number of groups. There's a huge difference between sample size and number of groups. See, if they would have said that there are 3 villages, one village taking only Ayurvedic medicine, the other village only taking lifestyle, the third village taking allopathy medicine, and then we compare, then it is more than 2 groups. So there should be no confusion. It cannot be ANOVA. Second, it cannot be an unpaired t-test because it is the same person. Suppose it is me, you have a blood pressure 200 by 100. You are my doctor. You give me an amlodipine. After 30 minutes, you see it is 150 by 100. So before and after. So it is again not an unpaired t-test. Next, see over here, we are not saying BP high or low. See, there is no concept of BP being high or low because suppose someone has a BP of 200 and you say it is 199, it is low. It does not make any sense. So again, it is not a quality data. So it is not chi-square. So without confusion, the answer was paired t-test. And the reason why we are explaining this in detail, because trust me, the similar question was there, as Kashish sir told, in NEET 2024 and might also come again in NEET 2025. Second question.
Now, in this question, in a hospital, patients are classified into 3 groups based on their severity: mild, moderate, severe. One patient is randomly selected from each group from a study. So guys, we have 3 groups here: mild, moderate, severe. And after dividing data in stratas in groups, so we have divided in 3 groups: mild, moderate, severe. When we divide them in groups and then we select randomly, it becomes stratified random sampling. Now, suppose scenario number 2, If they mentioned they have divided mild, moderate, severe, and now they have selected non-randomly or as per convenience, the answer will be quota sampling, which is not there in options. So we are talking about the different DDs of this question, right? And now, when will be the answer systematic sampling? Systematic sampling, when they will mention 10th house, 5th child, or anything. Whenever they mention the 5th, 10th, 2nd, this kind of scenario, it shows systematic sampling. Now, one more additional point I want to talk about this question. When data is divided in mild, moderate, severe, what kind of scale of measurement is this? If they ask you similar thing, if they ask you what kind of scale of measurement is this, nominal, ordinal, so here the answer will be ordinal, a separate point from the topic sampling. Now, coming to question number 3.
Wrongly matched pairs related to statistics. Now, guys, this was a question where you just needed to be slightly using a common sense because there was one option called as moments. Now, normally we do not hear the word moments, but actually in statistics, we call it as skewness. Moments is the same name used in mathematics. So if you talk to any mathematics teacher, they will say moments. We say skewness. Chalo, nahi pata tha ye option. No problem. Baki dekhte hain. Correlation, coefficient, relationship. There is no doubt it is always going to tell you about relationship. This is a standard. Next, standard error talks about variance. Yes, standard error, standard deviation, range, they talk about variance. Mean, median, mode, they are measures of central tendency. We have read it. It's the very first chapter any one of us teach you. It cannot be dispersion. So even by exclusion, you could have marked this answer as 3. Now, guys, if you remember, whenever we take your class, we always tell, boss, headings pe dhyan rakhne ka, because many times they are making the headings as a question because these are standard terminologies used by teachers across. Coming to question number 4.
Now, this question in statistics, what do centiles and quartiles primarily represent? So, central tendency, mean, median, mode, measure of dispersion, this we know, standard deviation, measure of location, the centiles, quartiles, they are measure of location. Now, suppose the option is not measure of location and they have written measure of position, then it will be also the correct answer. So, measure of location, measure of position, quartiles, centiles, they tell us about the location and position. Now, if I talk about similar question, if they ask, what they will ask, quartiles, how many quartiles divide data in 4 equal parts? Now, coming to centile, percentile, it divides data in 100 equal parts. Decile, it divides data in 10 equal parts. Tertile divides data in 3 equal parts, and quintile divides data in 5 equal parts. So all of them, they are measure of location or they are measure of position.
Okay, just to add over here, generally I tell in classes, after telling all this, I say how many parts a crocodile will do. It will depend upon how hungry the crocodile is. Yes. So guys, as sir told you, beautifully explained for this question. Coming to the next question, EPI. First question, total population is 100, previously infected with measles were 10. Now, boss, here, this was actually a very good question. Measles gives you lifelong immunity. That means you cannot get the disease. So you will be removed from the total population. So population at risk is 90. Students texted asking, sir, 100 क्यों नहीं होएगा? Measles तो एक बार हो गया, फिर से हो सकता है. Guys, that was how beautifully they merged. We always teach you in class, lifelong immunity, measles, a classical example. So population at risk for 90. New cases, 20. What is incidence? Number of new cases divided by population at risk. So it will be 20 divided by 90. So answer was not 20%. It was 22.22. Simple question, but had very good concepts over here. Coming to the next question.
Okay, so this question, organize the following steps in correct sequence of conducting a research. So first of all, you should have a research question. What you want to do? Why you want to do? So first is you should have a research question. Then you set your aims and objective for that research. So second will be you check for objectives. Then you go for study setting. Where you want to do this study? In a hospital, in a rural area, in a urban area, in your field practice area. Then comes you select your population. Then you select your population. And option 5, I want to tell you, then after selecting your population, you apply inclusion and exclusion criteria. We apply inclusion and exclusion criteria. We want to keep this population. Suppose if I'm doing a study on pregnant women, I want to know their iron, I want to know their anemia status. But if we have someone, so now my inclusion criteria is pregnant women. But if we have someone who is severe case, who is a severe case, so I'm not going to include them, because we are not going to unnecessarily irritate the patient who is already suffering from a severe disease. So we set these inclusion and exclusion criteria. So that will be option number 5 in case they give this option. Coming to question number 7.
Demography and family planning. Now, guys, they had asked to calculate the dependency ratio. Now, normally we read that the dependency ratio has got less than 15 plus more than 65 divided by 15 to 65. Now, again, if you remember, in our classes, we tell you, this is a US criteria. In India, elderly 60. AIMS people just modified it into 60. Now, even if you didn't know anything, boss, itna hi data diya hai, exam mein isi ko lagane ka. So less than 15 was 6,000, more than 60 was 2,000. So total 8,000 divided by 12,000. Simple calculation, answer was 0.66. Now over here, we would like to tell you today only, both me and sir have given you the recent data of SDR for India. Please understand, guys, even last session of NEET in the FMGE exam and this time also, INICET back-to-back they have asked question on SDR. So you might get the recent value of SDR because it is just released on around May 5th or 6th in your NEET or FMGE exam. So please be careful. Do see, we have posted it in the Telegram groups. You would be getting the update over there. Yes, guys. Next question.
Now, coming to vaccine. So, guys, this is also a similar question. Now, this is also a similar question which was there in NEET or FMG exam. So, this is a classical question. Which of the vaccine will you not give in a immunocompromised patient? So, this is an indirect question. SCID patient, which vaccine is contraindicated? So, among all the given 4 options, MMR is a live vaccine, IPV is a killed vaccine, and hepatitis B is a recombinant vaccine, and DPT is diphtheria and toxoid. They are toxoids, right? So here, MMR is a live vaccine which is contraindicated in immunocompromised. So here, the best answer will be 1.
Coming to the first question of health program, the 9th one. RMNCHA plus N, what is not included? Now, some students say the question was what is included? Multiple answer. Now, either way, you should know what is included. Reproductive, maternal, neonatal, child health, adolescent, and N stands for nutrition. There is no geriatric. So if it is not included, single answer, geriatric. If they say included, then answer will be option A, adolescent, family planning, infant population. This will be included. Next question.
Now, coming to during the Mahakumbh Mela, mobile medical unit along with multiple surveillance unit for monitoring case fever, diarrhea, respiratory illness. What was the primary role of this? So, guys, so basically we are setting up multiple surveillance unit that is only to diagnose it early and to detect the potential outbreak warning. So among all, if you see the first question, to reduce the need of medical professional, no, we don't do it. When we have such mass gathering and government is already spending so much money, why would they want to reduce medical professional? For immediate quarantine of all symptomatic individual, but to know who is symptomatic, to do a quarantine, we need to do early diagnosis as well, right? So we need to. And second thing, the option third, they have mentioned quarantine for all symptomatic. We do not do quarantine for symptomatic. We isolate them. We do quarantine for the contact. So this is also not to provide curative treatment. You know who is sick, then only you will be able to provide curative treatment. Now, so among all, the best is second option. And sir will also be appreciating the fact that AIMS signed a contract for this surveillance unit. You, sir, will be knowing there was some surveillance unit was set up by AIMS. What I know from the news, right? So
Exactly.
that is second is the best answer.
Now, I will just add for this question 2 other things. First, because AIMS had signed a MOU, you can see it is the AIMS professors making the question. Second, Mahakumbh is a very recent thing which happened in India. So you can understand that the questions which are being asked in your entrance, they are framed recently. They're not asking very old concepts. And that's why, especially in PSM, the concepts, the guidelines changes, and that's the reason you should be updated. And guys, for that, Kashish sir has given the probe. Please do look into it. It has all the updates at one place. Yes, guys, that is one way to keep updated for the exam. Coming to the next question. According to recent NACO guidelines, which of the following groups no longer classified as high risk group for HIV transmission? See, guys, when we talk about HIV sentinel surveillance, there are three groups. One, high risk group. In that, we have four people: commercial sex worker, men having sex with men, intravenous drug users, and transgenders. Second group is the bridge population: single migrant men, truck drivers. Third is the general population, who is the ANC female. Guys, it is directly there in your DAMS workbook. We have put it there. We have made you solve this question. We have made you write that this is a question, and they have repeated it. So answer was truck drivers. Yes. Another way to remember, truck people drive trucks. They will go over a bridge. So they are part of bridge population. You can remember it in that way also. Either way, the answer was truck drivers. Now, guys, HIV sentinel surveillance is a go-to topic again of AIMS, because AIMS professors are the pioneers who are doing the HIV sentinel surveillance for country. So these are some questions which are stock questions which will be repeated almost every exam. Coming to the next question.
Now, this question is 45-year-old man who is presenting, who came to Ayushman Arogya Mandir, and the blood pressure is given 148 on two separate occasions. What is the next step in the management? So, guys, I want to tell you two things before I start this question. Point number one is there is 25 by 25, 25 by 25, right? 25 by 25 is SDG, and the target says that by 2025, 25% decrease in hypertension. Second is 75 by 25. And then SDG, 25 by 25 is given by WHO, SDG. 75 by 25 is given by we say that 75 million should be on hypertension care by 2025. Now, this is two things for hypertension, additional things which I want to tell you. Now, second thing, whenever we have a patient who is having the high blood pressure and the patient is not having a comorbidity, so we advise reduce weight and stop smoking and all this. And apart from that, either A or B or C, depending upon the situation, we start the drug. Now, A is ACE inhibitor. You can start any one drug, A or B or C or D. Now, what is A? ACE inhibitor, B beta blocker, C calcium channel, and D diuretics. So among all the options, like admit patient and give IV antihypertensives, no, it is not. It is not the correct answer here. C, immediate referral to higher center. Why to refer the higher center? Because at PHC we have the MO he can manage. So here the best answer is start the patient with amlodipine. And second point I want to tell you, after 1 month we do a follow-up. If the patient is not able to manage the blood pressure, we add another drug. Now, first step, A or B or C or D. Next, if not able to manage after 1 month, then we can add any other drug along with A. You can add any other. So second is the best answer.
Coming to the next question on vectors. Standard question on vectors. They had given a match the following. Now they had given some option keys. You should be able to solve it. Yes. So should we actually answer this question, or we expect you that you remember the entire table of vectors and tell us that, sir, we have remembered? Because if you know, there is a full 1-page table on different diseases caused by vectors. It will surely be repeated in the NEET PG and the FMGE exams, probably in the UPSC CMS also. AIMS also asked this. Yes. So probably, Kashish sir, we can leave this for a homework for them. So at least we will know who is actively listening to this discussion. Yeah. Going to the next question.
Now, which of the following act as primarily concerned? So this is something, there is a act which came in 2023, Digital Personal Data Protection Act. So not only medical records, basically whatever personal records we are sharing on our digital platforms. So this act talks about the digital data, the data protection in our country. So option A is best answer there.
Now, guys, just to add over here, if you would have heard a recent controversy, which is even coming on various social media, that Apple is going to pay all of us $100 those because Siri listens to what we speak. You might have seen whenever we talk, "Aaj na walnut brownie khana hai." Suddenly, if you open Facebook or Insta, you do start getting the notification of walnut brownie of various organization. So to protect that, Government of India in 2023 has bought this act. Now, even if you did not know, you could have seen the option and just try to give a guess. Guys, sometimes in the exam, you will get such kind of outlier questions where we expect you to actually do a guess. Okay? Done? Chalo. Let us go ahead. Yes. Some overlap questions we are not discussing. Blindness, Sharma sir has taken. Scabies, Chester ma'am has taken. Contraception, HIV questions, Deepti ma'am has taken. Clinical cure of malaria, we have discussed by the pharma faculty. So these are questions which you can say PSM, but we are saying, okay, it's the clinics. That is how we said we have only 14 questions from core PSM. If you add total, it will be 19-20. Yes, we are sticking to 14. So with this, guys, we would like to end over here. I hope you have enjoyed the discussion. Guys, few requests. This is just an eye opener कि boss NEET में question आपके note से ही होएगा. Second, basics are always basics, like questions on incidence, population at risk, questions on statistical test. You are surely going to get such questions. So please do not miss out on the basic things. Over to Kashish sir.
Okay, so I agree with sir. So NEET is just closer than it appears. FMG, if you are FMG aspirant, FMG also very closer than it appears. So we both just want to say that focus on your notes, right? And do see what I have observed in past few years. They are not going to ask you direct things. So they are not going to ask you direct things. In this question, they don't ask you which of the following is not a central tendency, option mean, median, mode, variance. So they are not going to ask you direct things. They are going to ask you conceptual thing, comprehensive thing. They want to test your knowledge of the multiple domains. So basically, they want you to connect the various dots, right? So, but the notes, same thing. Some outlier questions, everyone, these are outlier for everyone. They are bound to happen in every exam, right? So you don't worry about the outlier questions. The main thing is to keep the main thing, right? Focus on your notes, focus on your PYQ session. We are going to start soon, NEET PG and FMG PYQ soon. We are going to start the series. So just go ahead. Don't worry about it. Don't think about INICET, right? Just focus on our NEET. Best wishes. God bless you.
Bye bye, guys. See you.